get that going. It is October, and everybody knows October is Breast Cancer Awareness Month. And Crystal Dula from the McCreary Cancer Center is going to tell us some interesting information. She always has lots of good things to share with us, and they do some really, really good things there. They have some neat programs. So I'm just going to let her tell you a little bit more about herself and what she's got going on.
Hey, good morning, everybody.
Morning.
Like April said, I am Crystal Dula. I'm the oncology nurse, or one of the oncology nurse navigators here at the McCreary Cancer Center. And we are going to talk about breast health and some awareness and some breast cancer issues. And then we'll also do a little virtual tour of the McCreary Cancer Center. So I'm glad you are all here with me today. And the first thing I want to talk about is just the estimated new cancer cases in the U.S. And you can see on this slide that one side is the male side, one side is the female side. And if you notice the male side, you've got prostate, lung, colon are their top three cancers. And then on the female side, you have breast, lung, and colon. So basically what sets those two apart is that men, are the only ones that have a prostate. So that's why they are the only ones that have a prostate cancer. But when you look at the breast cancers being number one in the women's side, and you think, that, to me, that's a big statistic there for breast to be the number one, because men still have breast.
We're looking at slide 1.
Yes,
I seem to have the introductory slide says breast health and awareness on my screen, or on your screen. And I think
on my screen it shows something different. Do y'all see it?
It's the one with the blue sides. It's just not enlarged.
Mine too.
So y'all can't see it when they switch?
The one I see is breast health and awareness.
Let me see if I can go out of that.
Well, I think you just have to click up the next screen in the PowerPoint.
Well, I clicked the next screen, but it did not show it to y'all. So let me see if I can figure out.
I've got the first screen too, Crystal.
The fun part of Zoom, technical difficulties.
This is. I'm trying to.
I think if you just click on that screen on your PowerPoint thing, then it'll pop that one up, and then you click the next one, it'll move along.
I think she was seeing the next screen, but we weren't.
Yes, I am seeing the next screen. So there's let's try it this way. I'm not going to start it. Can y'all see that screen?
Yeah, there you go.
Okay. Yeah. So it's probably just gonna look like it's not going to look exactly probably like a good PowerPoint. It may have some notes in the bottom of it, but I don't care. So anyway, this is what I was talking about with the male and the female. And you can see prostate and breast is the number one cancers that are going to be diagnosed this year for men and women. And then you've got lung and colon that come in right behind it. And that's truly what happens here in Caldwell County too. You've the top three or four are always going to be breast, lung, and colon. Sometimes prostate is in there. Sometimes a couple years ago, melanoma was in there. So, but the top three almost all the time are going to be breast, lung, and colon or colorectal. It's the same, even with rectal cancer, that's still considered part of the colon. So that's all lumped in there together. But what we tend to forget is that men still have breast tissue. Okay, that's the one thing we need to remember. Although, as we're going to see on this next slide, this is our breast self-exam. But what we tend to forget, and since there's a man on here, men get breast cancer also. We are right now treating one of our men for breast cancer. And statistics are different though. Of course, there's going to be more women with breast cancer. And that statistic is about 1 in 8 women will be diagnosed with breast cancer. And for men, it's like 1 in 100. So the really, really important takeaway, if you don't remember anything else from this today, is to do the breast self-examinations. And I know men are kind of like, oh my gosh, I'm not going to do that. But it's as simple as when you wash in the shower. Instead of using a washcloth when a man washes his chest, if he will just use the soap and his hand, he will be able to feel any kind of lumps or bumps. And the really sad thing about men is they think it's a bug bite or something like that, and they really get diagnosed at a much later stage because they don't realize they can get breast cancer. So the most important thing for men is when you're taking a shower, wash your chest with your hand with soap and water. That way you can feel all that breast tissue. And breast tissue runs from your collarbone down to your rib cage and from your sternum over underneath your arm. It's like a big square patch. It's the same for men and women. Our hormones make our tissue different, but it's still the same amount of breast cancer or the breast tissue. So here is a breast self-examination card, basically. And what it's telling women and men is to look at yourself in the mirror, to make sure that you full frontal look in the mirror, have your hands on your hips or down by your sides so that you can actually visualize your chest. Women, they tell you to put your hands on your hips and bend forward, so you will see a noticeable difference if one breast is larger than the other, or if it's one breast is more swollen than the other. And then they want you to actually do a breast self-examination standing and lying down. And this is only one time a month. You don't have to do this every day. It's just once a month, and you pick the day of the month that you want to do it. I tell people if they already, if they don't have a period any longer, if the women have gone through menopause and do not menstruate, then pick the first, like November 1st, December 1st, January 1st. If you're still menstruating, then you need to wait 10 days after that menstrual cycle, because our breasts react to all the hormones during menstruation. So you don't want to do it during that time. But this clearly shows you it's very simple. You start right under your arm and you go up and around. So you can either go in a big circle all the way until you get to the nipple, or you can go up and down. It doesn't matter. They've done so many studies on this, on which way's the best. And you're going to have different people tell you different things. It's whatever works best for you, and whichever you can do easiest, and which you feel is more thorough. If you are large breasted, you probably are going to have to hold your breast up with one hand while you feel the other hand, because you need to go all the way underneath it. And then you also do that standing, and then you also do that lying down. And they tell you to put a small pillow or towel under the back of the breast that you're examining. And that's just to give you more lift and to be able to feel better. I can tell you that some people have told me using powder or lotion helps them better, just because their fingers run across the skin easier. Again, it doesn't matter. It's what works for you. But the takeaway here is to actually do your breast self-exam once a month. And for men too, they need to be doing that in the shower. Then women need a clinical breast exam every time they get their physical, their yearly physical. Their doctor should be doing a clinical breast exam. And you should be able to tell them if you felt anything, or, you know, if there's just a spot on your breast that feels different. And 9 times out of 10, women will tell me they have literally no pain when they're diagnosed with breast cancer. They've never had any breast pain. They didn't even know anything was wrong. So you're not necessarily going to have pain with it. And then if you're over 50, you should be getting a mammogram. I say if you're over 40, you need to be getting a mammogram every year, but the guidelines say 50. Also remember, Not all breast cancer is inside the breast. Sometimes there is inflammatory breast cancer that starts out looking like a bug bite, or your breast feels like the outside of an orange. If you can kind of think of that little crinkly, bumpy feeling a lot, and people don't understand that inflammatory breast cancer is outside of the breast, and that goes untreated usually for a long time. Women will put hydrocortisone cream on it or whatever, just thinking they worked out in the yard too much. Maybe a bug bit them, you know, maybe their sports bra rubbed them wrong when they were walking over at the Greenway. So that will go untreated sometimes for longer than it should. So anytime you have any kind of strange feeling, whether it's a lump, a bump, a rubbery, leathery feeling on your breast, just please have that checked out. Because, I mean, that's just what we need to do as self-advocates. So it's not, you don't have to be terrified that what you're going to find is breast cancer, because most of the time, people, if everyone realized how many mammograms we do a day and how many cancers are diagnosed a month, people would not be so afraid to get a mammogram, because there's so much other stuff that could be wrong with you. A cyst inside your breast is going to feel like a lump. Fibroadenomas are going to feel like a lump. Sometimes caffeine makes us have breast lumps and tenderness. You can have mastitis, and some people think you can only have mastitis if you have recently had a baby and you're breastfeeding, but that's not true. You can get an infection in your breast when you're 19 and have had no children. So things like that happen. You can have eczema. You can have, you know, your tissue around your breast could just be lumpy and bumpy. But what the most important thing is that you know your breast, because you're doing your breast self-exams every month, and you would notice a difference, or you would notice something that hasn't been there before. So it's not always cancer, and that's another takeaway. Just because you feel something, it's not always cancer, but we do need to make sure that we're going to the doctor to have those things checked out. And then if it happens to be cancer, if you go and you have your mammogram and they do your biopsy, and you happen to have cancer, the takeaway here is that we're here for you. The McCrary Cancer Center is here. Caldwell Memorial or Caldwell UNC is here for you with some amazing surgeons. I mean, we have some of the best surgeons. And then the McCrary Cancer Center, we've got the medication and the radiation right here. We do immunotherapy, we do chemotherapy, we do radiation therapy. Right here in town. You don't have to go anywhere away from here. And then we have all kinds of complimentary support groups like yoga and pickleball and Quest for Survivors. Some of those things are a little bit different now during COVID, but we're hoping to get back to a more normal year, hopefully in 2021. But it is really nice to know that you don't have to go away to a big treatment center. We have UNC doctors here. We're owned by UNC Healthcare, and we have everything that you need right here in Lenoir. So I'm going to stop this one, and then I want to show y'all the inside of the McCrary Cancer Center, because it is so beautiful.
Can you describe the immunotherapy?
Sure, I can. So immunotherapy, let me see. Are y'all seeing the McCrary Cancer Center slide?
Nope, just you.
Okay. I just love Zoom.
I love Zoom.
I love Zoom. Okay, so we're going to start here in just a minute. So immunotherapy is a therapy. Now, a lot of people think immunotherapy is new and it's something that we've just started doing, which is not true. Immunotherapy has been around for a quite a while. What I can tell you is in the past probably 10 years, companies have really started realizing that our own immune system is the best thing we can do to fight many things, not just cancer, but many things. So what they do, when you start on immunotherapy, there's a gander of tests that they give you. Some of them are genetics. There's all kinds of different tests now. So if you come back, lung cancer has a lot of immunotherapy. Breast cancer has some. But say, like for lung cancer, there's a PDL and it has a number. And if you're a certain number, then you're going to get this immunotherapy. And basically what immunotherapy does, it's still kind of considered a chemotherapy, but not really. It really tries to boost your immune therapy using the tests that we've done. It boosts those things within us to help us fight that cancer. So it still is a drug, and it's still most of the time, well, a lot of immunotherapy can be IV, so you come to the center to get it, and some of it is pill form. So it just boosts your immune therapy, your own immune system to start working against the bad stuff that's in your body. All cancer cells are fast growing. So chemotherapy, immunotherapy, all that target those fast growing. The really great thing about immunotherapy is you don't always lose your hair. Some of the side effects are just very small. Some people get a rash. Some people might have some bone pain and stuff like that. Just depends on which immunotherapy you're getting. But a lot of times we have had many people that have literally no side effects and you can't even tell they're on a drug. But then of course there are those outliers that sometimes they have really, really bad reactions to the immunotherapy and we have to stop it for that reason. But most of the time the patients that we have on immunotherapy are doing well. And I'm trying to think if we've had a really bad reaction lately, but I can't think of one lately. I know a couple years ago we had someone that started on immunotherapy and he broke out in a rash literally from head to toe. I've never seen a rash that bad ever. And he just was not able to take the immunotherapy. I think we ended up giving it to him 2 or 3 times, but every time his rash seemed to get worse. So there are some people that will not be able to do immunotherapy, but what we're seeing statistically is that people are living longer and doing better when they can tolerate the immunotherapy.
What's the name of the drugs they use for that?
There is all kinds of names for drugs for immunotherapy, but Keytruda is one that you see a lot in commercials on TV. That's an immunotherapy. Trying to think of others. Some of them have the craziest names.
Well, what category are they in?
What do you mean by category?
Well, are they like an antibiotic? Are they like, what are they like?
No, they're still considered a not a chemotherapy. I mean, immunotherapy is the category, I guess, that you're asking for, but it's not an antibiotic. It's actually a systemic treatment for a disease. And the immunotherapy that we use is for oncology purposes and in cancer. So it still is like a systemic drug for cancer treatment is how we use it. Now there's other immunotherapies in other disease groups that we don't use. But a lot of stuff that you see on TV right now, any kind of cancer treatment, Keytruda is the one that comes to mind because I see commercials for it all the time. That is an immunotherapy drug.
Thank you.
Anybody else have a question about chemo or immunotherapy or breast cancer? Okay, so what I wanted to let you know is a little bit about the Cancer Center. So here's the front of our building. I hope y'all can see that slide. 212 Mulberry Street. So it's just up from the hospital. It's in the old Duke Power building, if anybody remembers that. So Commission on Cancer is a body of doctors, basically, that make sure that our services and what we provide for the community is up to the standard of everywhere else. About 25% of the cancer centers that you see in America have this Commission on Cancer approval, and we do have it here at the at McCray Cancer Center. We have Cancer Conference every 2 weeks, and so what Cancer Conference is all the patients that are newly diagnosed within that 2 weeks. We discuss in a multidisciplinary conference. So what that means by multiple disciplinary is we have the medical oncologist there, the radiation oncologist, the surgeons, the general practitioners, the nurses, hospice is usually there. Our social worker from the hospital is usually there, and we discuss the patient from start to finish on what that patient may need. We talk about any of their barriers to care, whether they have transportation issues, whether they have financial issues. We are so fortunate to be part of the UNC healthcare system because they have an amazing charity care for people that cannot afford their treatment. And we are so blessed to be a part of that. But in these cancer conferences, we talk about these patients and what they may need, and really try to get them involved in the absolute best care that they can have, and they get it right here at McCrary. We also have community outreach and support. So just like what I'm doing today would be considered community outreach, letting y'all know about our programs and what we do. But I also do this for churches and other community groups. So if any of you are in another group, I've done the knitting group, I've done Rotary, so many other things out in the community, and I'll be glad to speak at any, absolutely any group that would need a speaker anytime. I'll be glad to do it.
Can the patient attend the patient meeting where they talk about the patient?
I'm sorry, I couldn't understand you.
Can the patient attend the patient meeting where they talk about you?
We have never had a patient attend that meeting. It is normally just the doctors, nurses, and other healthcare workers, the radiology there. I didn't mention radiology and pathology are there. Radiology is there with slides or x-rays, and we actually get to see the cancer that they diagnosed. And then pathology is there with the slides to show us about the breast cancer or the whatever cancer was diagnosed, to tell us if it was high grade or low grade. So that cancer conference may be a little more than a patient. They may find out a whole lot more about their cancer than they wanted to know. So I'm sure if there's a patient that wanted to come, we could work that out. But so far, there's never been a patient in there. In the 18 years I've been here, there's never been a patient in that cancer conference.
Interesting.
So these are the support groups that we offer here at McCrary. Arm in Arm support group meets the third Monday of every month. We have guest speakers that talk about a range of different things. We've had the Senior Center be our guest speaker before. We've had guest cooks on there that teach us how to do nutritional meals. Terry Clapsaddle from the Diabetes Center comes and talks to us quite frequently about nutrition. The people from Quest will come on there and talk about exercise in cancer. And it's really just about what your new normal is after being diagnosed with cancer, and just surviving and thriving cancer. That's really what our Arm in Arm support group is all about. We also do Fresh Start here at the Cancer Center. So if you're a smoker and you want to quit, we have a Fresh Start program. We have restorative yoga, and we're still doing that twice a week, Mondays and Thursdays at 12 o'clock, and it is on Zoom, and anybody can attend. We have always said that if you are the survivor, if you're a spouse, if you're a friend or a family member, you're allowed to attend any of our support groups. So that usually touches everyone. Somebody either has a friend or a family member with cancer. So anybody can be a part of our support programs, and anybody can do our yoga with us. If there's anybody out there that wants to do yoga, they just need to contact me at the McCreary Cancer Center. That's 828-757-5448. And I'll add you to the email that I send out on Mondays and Thursdays, and you can just link right in with our yoga group. We also do Quest for Survivors, which looks a whole lot different during COVID than it did before. But for Quest for Survivors, we would meet at the Quest on Mondays and Thursdays from 2:30 to 3:30, and we just have the best time. We have the people down there teach us how to use the machines. We walk the track. We do water aerobics, we do silver sneakers, we do Zumba. We have the best time. It's a great program because a lot of survivors don't realize how important it is to exercise, especially after a cancer diagnosis. During your cancer diagnosis and treatment, exercise is the best thing for your body. And so we really push to our survivors and our patients that they need to exercise. So it's a great program. We also have a group of survivors that play pickleball down at the rec center. And then we have walking groups, and we'll walk through downtown Lenoir. We walked by the senior center several times. So just keeping people active and moving because it's so, so important. And of course, we do all these programs in conjunction with the Wig Bank. They're just a little sister partner with us next door. We have a cancer registry. So the cancer registry has to collect data on all the patients. It is a lifetime follow-up. So we have to maintain, we have to know where all of our patients are, what they're doing in treatment for their life. So our cancer registrar has about 2,400 patients that she has to keep up with yearly. And of course that number waxes and wanes depending on how many people have expired and then how many people are newly diagnosed. But it is a lifetime follow-up for her. And all her numbers are reported to the Commission on Cancer, and that's where all your statistics come from. So we share all of our data with everybody that has been diagnosed, what their treatment was, how they did. All the survival rates come out of that. So every cancer registry across the United States has to share those numbers. And that's where our statistics come from. That's also how we know which treatment works better. And those are how clinical trials start, because we see, this is not working as well as this one. And then we'll have a clinical trial that adds a new drug or takes away a drug, or sometimes we'll have a clinical trial and we go back to an old drug that we used to use because it was better. So that's where all that data comes from, is from that cancer registrars across America that keep up with all those statistics. And then it's all delved down into numbers where we get our 1 in 8 women will be, diagnosed with breast cancer, or which treatment is better for everybody. So those cancer registrars are such an important part of the cancer program. So in 2006, we were approved and opened our radiation center. And at first it was over at the hospital where the very first ER was in the hospital. It was downstairs on that first floor. And then we moved here to the cancer center in 2012. Dr. Holland is our radiation oncologist. And he is just a super doctor. Everybody seems to just love him. This is as you walk into our radiation oncology side. So the one great thing that we did for the cancer center was not to have everything so square. Whenever we were moving into this building, I don't know how many of you were ever here when it was Duke Power or when it was Lenoir Family Physicians. I think that's Dr. Bowen, Dr. Morgan. They used to be in this building, and it was very square. It was not very inviting and friendly at all. So we did a lean event, and if any of y'all know what that means, lean is I think it's the Chinese way of making sure that you decrease the number of steps that you take from one thing to another thing, or that I wish I could explain it better. I've been in so many lean events, they're amazing, but just to make sure that you're doing and you're able to do it in the fastest, most efficient way. And so our lean event consists of patients that were under current treatment in our radiation, because, you know, we did not have chemotherapy at UNC or at Caldwell at that time. It was delivered from a group of doctors in Hickory that came up here 2 or 3 days a week. So when we were doing this, we had patients that were under current treatment with them and in radiation. And then we also had patients that had gone to Duke and to Baptist and to the Treatment Centers of America, had gone to other MD Anderson. One of them had gone to MD Anderson in Texas. And we got all those patients together, and we spent about 2 weeks wanting to know what was the best and the worst from their treatments. You know, what did you like the most? What did you like the least? And those survivors literally came up with this cancer center. And I think that's really why it is so beautiful. But you can see just the beautiful lines. You can see that is just a picture up in the mountains over there on that right side. We had some amazing women that picked out the artwork for us, and a lot of it is found here in North Carolina. But you can also see that the colors are just soothing. They wanted a spa-like feeling. That's what the survivors wanted. And I really feel like we have it, even though it is definitely a doctor's office or a treatment center. So this is what our radiation oncology looks like. And y'all can see that huge painting right there. If you ever get to come see it in person, it's amazing. It's a Charlie Fry original. And it's basically looking through a magnolia tree at High Brighton Mountain, and the cross is lit up on top of that mountain, and it is just beautiful. It is just so beautiful. But this is our radiation console. I don't know if y'all can see me moving the little icon there, but right over here where all of those chairs and the computers are, this is where our radiation therapists sit. And right here is a great big 30-ton door, I think is what it is. And that is where our linear accelerator is, where the people are actually treated inside that room. This room here is our CT machine, because every patient that gets radiation therapy has to have a CT sim. And basically what that is, the doctor takes that CT picture and they say it's treating breast cancer. They try to make sure that they can treat just the breast cancer, and that, you know, if that breast cancer is laying near your heart or near your, your lung, they really try just to treat the breast cancer and keep it away from other major organs in your body. So that's why they're CT simmed, and then the doctors do just an amazing job trying just to treat the cancer and no other outlying organs. And then this is the linear accelerator. This is what the machine looks like that gives the radiation to the patient. And I had them, when I took the picture, I had them put it on a slant like that, because that machine can rotate fully all the way around. So if it needs to treat from this side to this side, it can do that. So it rotates completely around, and the patient lays here on this little bed, fully still. So the machine will go around the patient as needed. And then this is the front as you walk in. These are our sliding doors here. And as you first walk in, this part and this side is the radiation oncology side of the center. And then we also have medical oncology. We were approved to start giving chemotherapy in 2012. And when we moved in here to this beautiful building, Dr. James Hathorn is our medical oncologist. And I don't know how many people have gotten to meet Dr. Hathorn, but he is one of the funniest. He loves sports. He knows the patients from their daughter to their son to the grandchildren to the cat that's in the house. I mean, he knows so much about every patient. He remembers so many things. It's just, and he is just a fun, loving doctor and so amazingly smart. He was over the pancreatic cancer part of Duke University Hospital before he came here to the center, and we just feel blessed to have Dr. Hathorn here. He is just amazing. And this is what our center looks like. So this is the medical oncology side out front. You can see over here is the radiation side where you go down. So this is the other side. And you can just see how it's very spa-like feeling. We used a lot of rock. All this is rock here, all the way behind there. But then the colors are just soothing. Again, you can see the lines that are curved and not always square. You can't see this here as well, but it's a curved little wall right there. So they just use some just beautiful things in our center that the patients really didn't want it to feel like a doctor's office. And then this is where the patients are actually treated. So this is back in the chemotherapy part. This is a patient station. So you can see we have a refrigerator that's full of drinks. We have an ice machine and water. And then these cabinets are full of snacks for our patient that are donated by the Wig Bank of Caldwell County. So our patients always have snacks and things back there in the back to snack on. Each bay, so you can see here there are 2 bays and then the start of a 3rd bay. Each bay has a recliner and a chair and a TV for the patient. They can pull that curtain around and it can be totally private, which we have very few people do that. Most of the time we have somebody that's rolled their chair out in the middle of the floor and they're talking to the other patients. So we don't have many people that like to be private. They are usually back there talking, and it happens most of the time that the same people are treated on the same days, and they get to be friends, and they start talking about, they start talking about a wedding or a baby shower or whatever, and those conversations go on for a really long time. But it's just a really nice, relaxing feeling. Again, you can't see so much of the curves, but there are curved walls back there. And then in the very front of the building, we have all those windows. If y'all can remember the Duke Power building when you first came in to that reception area, we kept all those windows. So they look out into the garden. We have beautiful landscaping, and you can see the outside. So most of the treatment area is just full of windows, and our patients love that. We have bird feeders out there so they can see the birds. It truly is beautiful. And then this is our library. We have education for our patients, all kinds of pamphlets. They have room to sit out here and read those pamphlets. And then over here, we have an embedded financial counselor. So every person that comes in will go to see Holly, and they'll find out what their insurance pays for, if they are required to pay a copay or not. And then if they need it, Holly can help them apply for Medicare or Medicaid, depending on their age, and for the charity care if she needs to. So she is here all the time, and all of our patients see her whether they need it or not, just so they know the financial commitment of cancer, because it can be a large financial burden. And then this is our Susan Johnson Memorial Garden. This is on Mulberry Street right here. And these are all the windows I was telling you about in the chemo unit. But we have this beautiful memorial garden that was provided by Bill Johnson in memory of Susan. And it's just beautiful right there on the front of our building. And that is the McCreary Cancer Center. Does anybody have any questions?
No, it's very pretty.
I hope that everybody can come and see it. not necessarily needed. I am not hoping that on anyone. But we also treat hematology here too. So there may be somebody that has a B12 issue or maybe an anemia issue that doesn't have to be oncology. So we treat those. Dr. Hathorn does hematology as well as oncology. So I hope if you have to come see us, it's for one of those. But just to know that we're here and there are the best doctors, the best nurses and therapists down here to treat you and help you through your journey, to me is such a comfort. My own mom comes here to the center and she just loves Dr. Hathorn, and it's just great to know that we're here. And we work by the Commission on Cancer Standards. Everything is up to par here. And our radiation therapy has probably like 5 accreditations with APEX and ACR. And those are some of the hardest accreditations to get. You don't see many radiation oncology centers that have as many as we do. So we're very proud of that. Very proud that we have so much to offer here at McCrary.
And Dr. Hathorn's done some I've been to several programs that he's done. He's fantastic and like this just wealth of knowledge on all sorts of things. So he's really great.
And he's so funny.
Here at the center. Yeah, he is. He's a wonderful presenter. If you ever get a chance to see him somewhere, he's fantastic.
He is fantastic. Yes. Yeah.
Well, does anybody have any other questions for Crystal? Thank you so much for sharing with us. It was a great information.
Great.
I love seeing the center because, like I said, I've never actually been inside of it. Well, not since it was the cancer center. I have been inside of it when it was the doctor's office, and it definitely looks very different.
It is so different from them. We even enter, out front, instead of on the side where they entered. Mm-hmm. So it's 100% completely different and 100% completely designed by cancer patients.
Yeah, that's fantastic.
Yeah, yeah.
Well, thank you,
Crystal,
so much for your time. We appreciate it.
Thank y'all for having me. Anytime.
Hopefully maybe next time it'll be in person.
Yes, would that not be awesome? I would love that.
One day soon, we hope. Bye, Crystal.
Thank you.